Thank you so much for joining us today. This is a fantastic opportunity. I'm just trusting your judgment on this. You are joining us at the best time ever in your life. We're about to begin a segment here that is very educational, richly informative, and you will never live to regret it. It is my privilege to welcome to the studio today Dr. David Burt. Dr. David Burt, a well-known immunologist. And I know you know this is someone who is a doctor who is very specialized at treating and addressing our immunity or issues related to our immunity and such as allergies and so on. But today, the focus is, like it is around the world, on COVID-19. So I'll be asking some questions today that emerge from many of your homes. And you're asking these questions, and who better to answer these very important questions than Dr. Burt. Welcome, Dr. Burt.
Thank you. It's good to be with you today.
Great. Let me begin with this question that is a frequently asked question. There are individuals asking this question with regards to the COVID vaccines, and some are speculating and are even nervous about accessing these vaccines because they're saying they have been developed too quickly for them to be safe. What are your thoughts on this?
I can understand why people may be thinking this about the vaccines, because it is a remarkable feat to develop a vaccine, have it approved, and have it administered within one year. 1 year of knowing about this new virus, SARS-CoV-2. So it's understandable why people are a bit nervous and cautious about taking the vaccines. But as I mentioned in the presentation, a lot of the groundwork for this technology, especially the new technologies of RNA and DNA vaccines that have been used, the groundwork for these technologies have been under development and been modified and improved and fine-tuned over the last 15 to 20 years. And in fact, one of the vaccines that's made by AstraZeneca, this is a DNA vaccine, they're using the exact same technology that Johnson & Johnson used for the Ebola vaccine that's being used at the moment and approved for use to protect against Ebola in Africa. So it seems that these vaccines have been developed rapidly, but a lot of the groundwork was already done, which enabled the vaccine development process to go ahead really rapidly without having to bypass any of the safety issues or the manufacturing issues in terms of quality.
Oh, that's helpful to know that, so we can have a little more confidence because so much work has been done in the past in developing this. So I heard this question asked of Dr. Fauci, and you're our Dr. Fauci today.
I'm not sure about that.
Can the mRNA and DNA vaccines modify our own DNA?
No, they can't. And this is another question that obviously crops up. And there's been a lot of misinformation about this in social media. A lot of individuals conflate these mRNA and DNA vaccines with genetic engineering, modifying plants, and these are different technologies altogether. In order for RNA or DNA from an external source to integrate into our own RNA or DNA, you really have to have a certain type of RNA and DNA, and you need certain types of enzymes that can actually incorporate that material into our DNA. And these vaccines don't have that. And in fact, even the viruses, RNA and DNA viruses that we are all exposed to, like flu, which is an RNA virus, measles, mumps, adenovirus, these viruses, even though they infect us, they cannot incorporate their DNA or RNA into our genetic material. And in fact, the only virus or classes of viruses that can do this are called retroviruses, and HIV is one of these, and that's why it's so dangerous. It has certain enzymes that can enable its RNA to be retro-transcribed to DNA, and that's by this enzyme reverse transcriptase, and then that DNA can be incorporated into our own DNA because it has an enzyme called integrase. And that's why these viruses are so dangerous. But most viruses that we encounter don't have these enzymes and can't do that. And definitely the vaccines cannot do that.
I'm glad to hear that. I'm sure people in their homes today are appreciative of this response. And if you're just joining us, I'm so happy you did, because we have with us our immunologist, Dr. David Burt, and he is helping us to understand and wrap our heads around all the COVID realities and what's the integrity of these vaccines and what are the risk exposures we do have. Now, if someone asks you, Dr. Burt, if they say that they have already tested positive for COVID, so they're asking now, do I still need to take the vaccine because this thing has already knocked me down? What would you say?
Well, the vaccine should be taken, and that is the recommendation. Individuals who have been infected with COVID, depending on the individual, they might have a different level of immunity against the virus. Even some individuals who have very severe medical conditions because of the virus, sometimes they don't have a very strong immunity. And so because it's not clear as to what level of immunity you have, it's always better to take the vaccine. And there are recommendations in terms of how long after you've been asymptomatic, you should take the vaccine. And I think individuals need to go to their MDs, their doctors, to find out what that time frame is. But definitely, the recommendation is that even if you've had COVID, you should take the vaccine.
Okay, great. And thank you for emphasizing that very important points here, especially talking to your own family doctors.
Exactly.
Because they have your history and all your
Yes.
details and know what kind of risk exposure you may have or not have. All right. But if someone has not tested positively, they're negative for this vaccine and they want to take the vaccine, how long will the vaccine provide immunity against the virus? Is this for the rest of my life, or is it until next week, next month, or can you say?
Well, it's not clear. What we do know is that after infection, immunity or the antibody levels and your T cells can last for up to 3 to 5 months following infection. And it's hoped that the vaccine will provide a more robust immune response. And so the studies are being done at the moment to see how long the vaccine immunity will last. Of course, immunization started in December, so we still have a number of months to go before we can really see whether the vaccine can outdo the natural infection. But I think most of the vaccine researchers believe that the vaccine is going to be at least as good, or if not better, than the natural infection, but it remains to be seen.
Okay, good. Now, we just had Super Bowl, and there were some folk in the stands, and you wonder if folk have had their COVID shots, was it necessary for them to wear masks?
That's a really good question, because you'd think, okay, I'm vaccinated, I'm immune, off with my mask. But there is an issue there because, and I think I mentioned this in the presentation, vaccines are just one of the tools in our arsenal of protective measures against COVID-19. And why I'm saying that is because at the moment, only a small percentage of the population has been vaccinated. In Canada, it's less than 3%. Mm-hmm. And that means that there's still a lot of vulnerable individuals out there who could get the vaccine, get infected. Mm-hmm. And one of the things about the vaccines that we have to consider is that these vaccines were approved or authorized based on emergency use. The clinical studies are still ongoing, and the vaccines were authorized based on the fact that they were safe, but also based on the fact that they protected against mild or severe COVID that was confirmed in the lab. But we don't know for sure whether these vaccines actually stop infection. So it's possible that even though you've been vaccinated and you're not showing any symptoms, you may still have been infected and you could still transmit the virus. So it's not clear that you can take off your mask. And also, as we all know now, there are a lot of variant viruses that have emerged. And some of the vaccines seem to be effective against the variants, but others are not so effective. And so really, until we have a better handle on how these vaccines do against the variants, and until we get herd immunity, where the majority of the population is immune, you still have to follow the guidelines in terms of social distancing, wearing masks, etc.
Thank you. I just want to welcome those who are just joining us today. We are having with us Dr. David Burt, and he's an immunologist, and you know that's a most important individual, especially at a time like this, when we are grappling with understanding the COVID-19 virus. This is a specialist on immunization and building immunity and addressing these viral challenges that are just a real part of our existence these days. Just so happy to have you, Dr. Burt. Now, we don't know, someone says, the long-term effects of these COVID vaccines. And so one person is volunteering to wait a long time to see whether there are some effects, side effects that would be classified as negative side effects of the vaccine. What would you say to this person?
Well, it is true, and I understand the question. It is true that we don't know the long-term effects of these vaccines because they've only just been rolled out since December, last December. What we do know is that these vaccines, in terms of their any adverse reactions or rare reactions that you might get from the vaccines, they've passed the same safety criteria as all of the previous vaccines that we've had for decades. And that is 60 days after the last immunization, the regulatory authorities need to see evidence that there's no significant adverse effects over 60 days. And those vaccines have passed that criteria. But what we don't know are the long-term effects. But I would say that we know what the short-term effects of catching COVID-19 are. And that could be mild disease, it could be more severe disease, it could be hospitalization. You could end up on a respirator, and God forbid, you could die. That's right. There was something reported on the news yesterday where a 9-year-old in the United States who didn't seem to have any complications or predetermined medical issues died of COVID.
Wow.
And so I would say, let's not worry about the long-term effects, because the short-term effects are even more dangerous.
That's right.
And these vaccines will be monitored, and the individuals who receive them will be monitored over a number of years. And even at the moment, we know that the really serious adverse effects are rare. But there's going to be continued monitoring, and we'll know in the future.
All right, thank you. Now, this question, I'm sure, is from an older person. Has heard that the COVID vaccines can cause infertility. Is that true?
Well, I think if that was the case, whether you're old or young, I mean, it's an important issue. But no, it's not true. And this is another it's another piece of misinformation that is circulating through social media, and it comes from a number of places. Especially, it seems that someone has noticed that the sequence within the sequence of the S protein of the SARS-CoV-2 that causes coronavirus, COVID-19, there is a sequence, just a few amino acids, that is the same on a protein that humans have called syncytin, and this is a protein that's important for placenta development. During fetal growth, etc. And scientists will tell you that it's impossible for the S protein to induce an anti-fertility type of response or an autoimmune response based on that sequence. But the rumors have spread, and the rumors aren't correct. And in terms of reproductive effect on the reproductive processes, part of the studies that had to be done before this vaccine was tested in humans was that the vaccines, at least in animals, had no impact on the fertility or the reproductive ability of the animals. These studies were done. And in addition, people ask about pregnancy. It's not thought that these vaccines have an impact in terms of on pregnancy and outcomes. If it's related to the S protein, we know that I think over 40,000 pregnant, obviously women, have had COVID-19. They've been infected, and there've been no issues in relation to reproductive, in terms of babies being born or any defects. So the whole question about the impact of the virus, the vaccine on the reproductive system and fertility, it doesn't seem to be valid.
Now, here's a question that I'm so happy for this question because I had this question myself. Mm-hmm. Someone is asking, are there natural products that we could take that will help to protect us from getting COVID-19?
Okay, this is another question that's very important to a lot of us. It's important to have a healthy immune system, and so it's really important to have a healthy lifestyle, to make sure that we're getting enough sleep, don't have too much stress, and for most of us, we're getting enough of the vitamins and nutrients, vitamin D, zinc, which are important for the immune system, to keep the immune system healthy. At the moment, there is no real evidence that any single natural product or combination of them can prevent you from getting COVID-19. There are anecdotal stories and some anecdotal evidence that some substances may help you in terms of reducing the severity of the COVID infection. But really, in terms of scientific studies, clinical studies, there aren't enough of these studies around natural products to be able to say that they can impact your ability to contract COVID and your ability to have a lesser COVID disease. And I always say that even if you have something that can reduce the symptoms of COVID, ideally, the point is to prevent getting infected in the first place. And I think there's a misunderstanding about the immune system, because there's something special about the immune system. It's a system that can prevent infection, and I think that's a goal that we all have. We want to prevent infection. So even if you found something that can reduce the symptoms that you have, if it's a natural product, it's not going to prevent. And also, the immune system has a memory, so that when we give a vaccine, we teach the immune system how to recognize a particular pathogen. And there's no natural product that can actually do that. So maybe in the future, there'll be more rigorous clinical studies done around natural products. But at this time, there isn't enough evidence to show that a natural product can prevent you from getting COVID. But it's important to be healthy, because the immune system, to work properly and to work properly with a vaccine, needs to be healthy.
Okay, wonderful. Now, most of our questions are just skewed towards your immunological understandings and as an immunologist, but this one is going to have you marry your faith conviction and merge that with your understanding of immunology to respond. Because this is a question. I was in the gas station recently, and I saw a man driving through with a small truck that was modified with some lights on the top, and I read that what was on it. It said COVID-19 is the vaccine is the mark of the beast. Yes. As a Seventh-day Adventist immunologist, how would you respond to that?
Okay, so I'm not a theologian. I mean, my doctorate is in immunology, not theology. Maybe it's a better question for you, but I'll try and answer that in my layman terms. As far as I know from Revelation, and Revelation is a book of symbols, the mark of the beast is not thought to be something that's tangible in terms of a real obvious mark. The mark of the beast is meant to be symbolic of the loyalty that one gives either to God or to this beast, which is represented by a power, a superpower that is being controlled by Satan. So it's the mark of the beast is about loyalty, where your loyalty lies. And this loyalty is related to your loyalty to God or to the beast. And Revelation tells us that it's a loyalty that is going to be determined by whether you follow the laws of God or the laws of the beast or the pronouncements of the beast, and not whether you take a vaccine or not, or not whether you wear a mask or not. It's really about where your allegiance lies. Who are you going to worship? And I think any reading of Revelation will tell you that this is what the mark of the beast is. It's not a vaccine, and it's not wearing a mask.
That is so correct. This is all a matter of allegiance. And that's why, we're counseled to remain faithful to the end.
Exactly.
That is to God himself, and not to any other power that seeks to divert our allegiance or our commitment. Hence, in the forehead, which is the seat of your decision making and your commitment, that is expressed through your hands. But this has nothing to do with the mark of the beast at all.
I knew you could explain it more effectively as a pastor.
I'm just re-emphasizing what you said. You did a fine job on that, and your pastor must be proud of you. Now, which of the COVID vaccines would you deem to be most effective?
Well, from the clinical studies, we know that the messenger RNA vaccines from the Moderna and Pfizer are producing, these are 95% effective. And that's a remarkable rate of efficacy. And as I mentioned in the presentation, we've seen the same efficacy, at least for the Pfizer vaccine, in the real life, in the field where these vaccines have been administered from studies in Israel. The Johnson & Johnson, AstraZeneca type of vaccines seem to be slightly less effective. These are the DNA vaccines. But we all have to remember, and I think the efficacy is around 70%, 69%. But we have to remember that before the vaccines were developed, the FDA and other regulatory authorities were saying, if we can get a vaccine that's at least 50% effective and safe, we'll take it. Mm-hmm. So in reality, all of these vaccines are probably going to be useful in terms of protecting you against COVID-19. And in reality as well, I don't think we're going to have a choice in terms of what we can take. And I would say that whichever of these vaccines are available, you should be taking that vaccine, whether it's 70% or 95% effective. So they all meet that criteria of efficacy that the FDA were aiming for.
That is so good to know, because I sense there's a whole lot of dialogue going on, even in households, as to which one they would prefer to have over and against the others. But that clears it up very nicely. And we're winding down and just welcoming those who are just joining us. You've missed some great information, but I'm glad you aren't left out of all. Listen to this question. And I heard someone say this on CNN recently, that his community has suffered abuse at the hands of medical science in the past. And so they're asking, why should they trust themselves and their community to the vaccines at this point?
Mm-hmm. That's a very important point. And yes, we've all heard about the incidents like the Tuskegee incidents, where, and other situations where people of color have been refused treatments that are available. And yes, there are historical issues and injustices that have been targeted certain populations, visible minorities and different ethnic groups. And that has been an issue, and that's why a number of individuals say, how can we trust the scientific community when this has happened to us? Mm-hmm. And it's also, I think, been this feeling has been enhanced because there's still a lot of injustice in our society at this present time. Mm-hmm. And actually, even in the United States, we know that although the Black population has been impacted the worst by COVID, less than 10% of that population has received COVID vaccine versus 60% of the Caucasian population. Mm. So these discrepancies, and there are many reasons why, but these discrepancies seem to continue. And we know that, your health care and the way you're treated often depends on your postcode. Yeah. So these are real concerns that people have. And that's why there are a number of organizations, one that I'm part of that was established by the City of Toronto, which is the Black Scientist Task Force on Vaccine Equity. And the reason why this was started was because it was felt that our community need to hear from people who are like them, who look like them,
Right.
who live in their community,
Yeah.
who have expertise in science. In these, and part of the members include scientists, doctors, healthcare professionals, and health equity experts. And the idea is that we can engage our community and try and help them to understand in a scientific way, but also in a culturally sensitive manner, what COVID, the impact is, how it's affecting us as a community, and give them confidence in the knowledge that we can give to them. And so there are a number of organizations like this starting up to help specific communities, to give them confidence. And I would say, in terms of situations like Tuskegee, after that was exposed, one of the things that one of the positive things that came out of that was that new rules and regulations and checks and balances were put into the clinical trial process, so that there were established review committees. These are independent review boards that would vet any clinical trial that was being proposed to make sure it was ethical, to make sure that anyone who's involved knows the risks and the benefits. And these types of changes were only implemented after situations like Tuskegee. So it's unlikely that these same issues will happen again. And I always like to say that, yes, these happened in the past, but we shouldn't allow injustices in the past to prevent us from taking advantage of new opportunities and progress now and in the future.
Yes, these suspicions are real.
Yeah.
And sometimes they can be obstacles, yes?
There's just something, I remember you asked a question and I talked about pregnancy. And at the moment, the vaccines that have been authorized aren't approved for pregnant women. I just wanted to make that clear. They aren't approved because there weren't enough pregnant women in the trials that were done. And I think as the vaccine is rolled out and more information is obtained, that might change. Because I know in America, some of the doctors are saying they don't see any reason why pregnant women shouldn't be vaccinated. But at the moment, it's not recommended unless the risks of getting COVID outweigh any potential risks in terms of pregnancy and the child that's going to be born. I just wanted to, and also just going back to the comment you made, if you have any doubt, you should go to your physician, your MD, because things are changing all the time. We're chasing a moving target,
Right.
And it's important to go to your physician who knows your situation.
I like that too. Good. So as we wind down these last two questions, I want to ask this, which you can share as a Christian immunologist. How should my Christian faith impact or influence my attitude to taking this vaccine?
I would say that, first of all, as a Christian, I should be concerned about my health. I mean, our bodies are the temple of the Holy Spirit. As Seventh-day Adventist Christians, we have a strong emphasis on a health message. And like many faith organizations, our church supports the sensible use of vaccines as part of our overall health regime to make sure that we're healthy. So I think in terms of our bodies being the temple, I think this is compatible. Vaccination is compatible, and if you read the statement on immunization that our church has put out, I think it's very balanced, and it's basically asking people to look at the science and to make informed decisions. And there's another aspect too as well. We're told in Philippines that we shouldn't be just looking after our own interests, but we should be looking after the interests of others.
Right.
And vaccines don't only protect ourselves, they protect the community if enough people are taking them. And especially individuals in the community who, for some reason or the other, may not be able to take a vaccine because their immune system might be totally shot because they're immunodeficient, or they may be strongly allergic to things in the vaccine. But if enough of us are immune, then we get to that position of herd immunity where we can protect our community and protect the individuals who can't. And I think this is totally compatible with our values as Christians, to be interested in the lives of others. And the bottom line is, we want healthy people to be able to witness to, right? We want people to be healthy. So there are a number of reasons why I think vaccination is compatible with our Christian values and our faith.
Excellent. To that I say amen. My last question to you, Dr. Burt, is there's just so much misinformation about COVID and the COVID vaccines. Where can I go to get some reliable information?
Well, and I understand how difficult it is for individuals. You see individuals on social media who seem to have credentials that are long and extensive, and yet they're saying things that are very confusing. And I would say, and I always tell people, if I have a motor car that needs servicing, I don't take it to a dentist, I don't take it to a veterinarian, I take it to a certified mechanic who knows inside out that car, that vehicle, and knows how to deal with it and how to treat it and how to repair it. And I think there's a tendency for us to just absorb information from left, right, and center when there are experts out there on the CDC side, Health Canada, FDA. These are where the experts are. These are the authorities that authorize and affirm the clinical studies that have been done. Yeah. And also, it's interesting because a lot of these conspiracy theories have been debunked. And sometimes it's just as easy to write down, do these vaccines, do they cause us to be magnetic and interact with 5G? If you put that onto Google, you'll see a lot of fact-checking sites that tell you that this isn't true, and they'll explain why not. And sometimes I think sometimes we're a bit lazy. We just accept things that come through, through our WhatsApp without investigating them carefully. So there are places where we can go. And actually, one interesting place is there's a site by the Associated Press, which has a section where they're fact-checking all of the information that's coming on the media, social media. And these are very good sites. So I'd say go to CDC, Health Canada, FDA, Associated Press, and you'll get the correct information. And it's important, I think, because as one of the writers in, I think it was Christianity Today, said that we need, as Christians especially, to be careful that we're not passing on false information. Right. There's a commandment that says we shouldn't be bearing false witness.
That's right.
And sometimes inadvertently, because we're not fact checking ourselves, we're spreading information that isn't true. So there are places where we can go, and I would advise individuals to go to those places. At least start there, and then ask ask your physician, ask people that you know who are working in those areas if the information is correct or not.
Thank you. Thank you so much, Dr. Burt, for sharing with us today. And like the way you're ending here, we will not subscribe to the sensational, but we will go to pursue the facts in these areas and sources that are reliable, who have done the fact checking on our behalf. We thank Dr. Burt for being with us. An immunologist is in high demand today. And there are individuals calling him from the United States, from England, and all over. And we had the privilege of having him here today. Information shared today is for your benefit. Manage it well and stay in touch with your doctor. May God bless you. And God bless you, Dr. Burt, for what you have done. And it is so encouraging to find someone of faith who is also an authority in this area that is of such a concern today.
Well, thank you for having me.
Much.
It's a pleasure to be here with you.
Great. After COVID, we will shake hands. Thank you so much. God be with you.